and we're glad to be back in conversation. And this is our first installment of 2022. And I'm very, very glad. And for all those out there who are joining us, apologies for the slight delay, as always, a few technical hitches. But we're back with a bang. And today I'm very glad to be hosting Dr. Caitlin DeClercq. So Caitlin, how are you?
Doing very well. Thanks so much for the invitation to be here.
It's my pleasure, and thanks for joining us. And what a great way to start the year with some highly topical conversation. But before we get onto all things disease and epidemic related, we're also going to talk a bit about architecture and a bit about, of course, your pathway into academia. But first of all, where are you calling in from today?
I am in New York City, and those of you who might know New York City a bit, I'm on the Upper West Side, just a couple of blocks away from Central Park. So one of the kind of the great marvels of New York City, particularly Olmsted. I'm lucky enough to live just a couple blocks away.
Oh, wonderful. Well, and I also live in New York, but a fair way away from you, down in Brooklyn. But I've actually escaped for a few days, and I'll be working down here in Austin, Texas. But I got out just after the snows. But maybe you can just tell people how it is in New York right now. There's been some big winter weather.
Yeah, we got something like, I don't know, 6 to 10 inches of snow. So the city was beautiful for a couple of days, but now it's kind of to the point where there's piles of garbage. You know, the snowplow, the garbage trucks here kind of have a day job as snowplows when it gets really snowy. So there's garbage everywhere, the snow's starting to melt. So this kind of the twilight is done, but we've got one last day of sledding ahead of us in the park this afternoon.
I'm jealous of your location near the park because we definitely haven't got any of that near where I am. It's far too flat. But it's funny because like I've been hearing a lot of people talk about how New York is the host of the I suppose the unconventional Winter Olympics because of all the different trials and tribulations we have to pass just to try and get across the road without drowning in the slush. And it's funny, friends back in England where we don't get so much snow, they're like, oh, it looks so amazing on the news. And I'm like, yeah, today, but you wait. In 1 or 2 days' time, it becomes rather problematic, and it's interesting as like talking about urbanism and the urban environment, like how the weather can have such a big effect on such a city. And although New York definitely has the logistics to deal with it and the resources in place, it is kind of funny how it completely changes the landscape, and it does make it beautiful aesthetically, but it does make it quite problematic, doesn't it?
Absolutely. Yeah, I mean, even just, like having to navigate the stairs down into the subway. I mean, that's also like particularly dangerous. It's like I've learned to kind of see, okay, is this sort of like scary stairs weather, or is it, still fairly safe stairs weather? I come from California, so I'm not used to any sort of weather besides, glorious and beautiful. So it certainly has been something to adapt to out here.
I was going to say, yeah, I imagine that is quite a change of pace. So, well, you teach at Columbia, right?
I work in the Center for Teaching and Learning there. So I essentially work with graduate students on their teaching development. So in essence, I teach grad students how to teach, but I'm not sort of immersed in a single department. Rather, I support kind of all departments on campus.
Oh, cool. So what does that sort of entail in your sort of day-to-day work life?
Lots of different things. I mean, I wear many different hats in this role. So one thing I do is I work with a large fellowship program that we offer. It's called the Lead Teaching Fellows, and this is grad students across campus. We currently have 49 of these fellows in different departments across campus. Essentially, they work with us to support teaching development in their departments. So they lead workshops in their home departments. They sort of make sure that their colleagues are aware of the resources that we offer at the Center for Teaching and Learning. And it's a really nice way to sort of ensure that wherever grad students go for their next stop after Columbia, as well as any teaching they do at Columbia, is sort of, informed by the best research on teaching and learning, and that they kind of cultivate and are able to articulate and implement effective and intentional teaching practices. So that's one thing. I also lead workshops. I'm also going to be putting together a seminar, like a 4-part seminar later on this semester about kind of how to leverage physical classroom environments in support of learning goals. So I kind of do a lot in this role, which is why I love it so much.
Sounds like it. And well, talking about the weather and the pandemic, are you teaching back on campus, or is Columbia still all remote at the moment?
We're about ready to jump in. I think it's this week, if not next week, back into face-to-face instruction. And, some of our offerings are going to be at the CTL. Some of our offerings are going to be staying online because we found that that's, accessible in its own way. But there's really nothing that can kind of replace the face-to-face interactions and sort of connection and community building. So we're going to do sort of a mix of both of them at the center. Sort of, we kind of are in the same flow as campus, but we also are kind of, ensuring that we have a mix of offerings available.
And I guess now we're kind of, I'm not saying we're coming out of the pandemic, but the pandemic's been going on. It's definitely part of the new normal, especially for the academic and the university teaching world. So how has it sort of affected your work there at CTL? And I mean, have things changed dramatically, or has it been a fairly simple transition, sort of going between virtual and hybrid and being a campus-based university?
It's a great question. I mean, I think centers of teaching and learning in general, this has been really a moment of kind of campuses really turning to centers like mine to guide them on how do we make this very quick transition to online teaching and learning. So, there's some folks who are very well versed in kind of, using technology in their classrooms, but for many of us, suddenly doing everything in Zoom was very much a change of pace. What it kind of helped us do, I think, is really think through how do we not just kind of ensure that all of our offerings could kind of go on to Zoom, but how do we model best practices? So a lot of kind of the initial learning curve was, okay, I need to be good enough at Zoom to not just kind of do the thing, but to also model to anyone in the session, here's how to use these different bells and whistles. Let's experience it together. How does it feel to be in a breakout room? What kind of signaling did you need, etc. But it also has really encouraged us at the center, at least on my team, to use this opportunity to think creatively about how we get resources to students. So before, it was kind of the days of like, you come to a workshop, you get a big printed, booklet of handouts, and now we've moved a lot of our a lot of programming or kind of a lot of information online. So there's a lot of kind of on-demand resources students can get. So it's really kind of allowed us to think creatively about our work, and I think make our work a lot more accessible. So you don't have to just be physically with us in space and time, although we love that. We kind of, those of us who are in this role, gravitate toward it because we like being part of these learning communities. So in essence, I think it's been, tough like any challenge, because anyone living through a pandemic has their kind of own like life to deal with on top of all of this. But I do think it's been very much a moment of I think creativity, and I think of new ways of working, which has been fun.
Yeah, I agree. It's been challenging at times, and I can speak on, from behalf of the publishing world as well. But it's been, there's a lot of beneficial adaptations that have taken place and a lot of exciting opportunities. I think with publishing and to some degree academia, we've kind of like dragged ourselves into the latest century through, with technology. And I think we're all ready to move into this next chapter in terms of how technology is impacting publishing and access to information and sort of learning and teaching. But I think it almost needed a pandemic or something like this to really kind of like drag us out of the doldrums and make us, sort of take on these new challenges. And it's been really interesting to see how people have adapted so quickly. And it's democratized access to information in many ways. More and more people are able to attend conferences. So there's a lot of silver linings, even if perhaps, as you said earlier, we can never quite, compete with the face-to-face conversation, especially with a lot of our academic kind of meetings and conferences, which of course have all gone virtual as well. But fingers crossed, we some of those later in the year.
Yeah, I mean, I think to come to mind also, I mean, one, I think, in terms of silver linings, like one is, I think, needing to rethink one entire pedagogical practice and context, I think has been a moment for all instructors, myself included, to really think about, like, what's my intention now? Like, what am I trying to do? Like, I've got to really think about how do I do the thing I want to do, not having all of the tools at my disposal. I think that's actually been nice, right? It's been a good moment of reflection, even if it's been really challenging. But a conversation a lot of our grad students are having now is, there were a lot of really nice tools that were afforded by this online environment. Like, the chat function, yes, that can be annoying, but it's also a space to give voice to everyone in real time in a kind of synchronous meeting. How do we replicate that? And maybe how do we leverage something like that when we go back to the face-to-face classrooms? I think we're trying to kind of say, what are some of the lessons learned from this moment? How do we not just like throw them away now that we're back in the classroom, but maybe bring some of these kind of technological innovations? How do we do Padlet or kind of this collaborative documentation, even if we're in these face-to-face settings?
Yeah, no, I think you're right. And I think there's been obviously a positive impact on the environment in many respects, and on the way that we perceive, the urban space and the urban landscape and the way that we use space. And You know, it's been really interesting, and I think there's going to be a particularly interesting year now that we sort of come to terms with this new normal, and hopefully we're able to sort of return more to, I guess, hybrid life. But again, I think there's lots of benefits that we're going to take into whether it be conferences or in teaching, publishing, and all these other different things. Okay, well, let's jump around a little bit. So we know where you work, but tell us, how did you get there? What's been your pathway through academia? Did you start as a scholar? Was that always your intention, or did you start in practice? Tell us about your education and how you ended up being an academic.
Sure. I mean, I guess it's, yeah, I've got one of those CVs that really only makes sense in narrative form. I'll try to keep this brief. So I think like really my journey to where I'm at now started with my first professional sort of job, which was as a health educator. That's where my professional upbringing happened. I was a health educator on a campus. I've kind of always been on a college campus, worked at UC Berkeley. In that role, I had a chance to kind of do classroom teaching and also do kind of the design of kind of community-wide interventions. And I always felt like there was something really important and profound about the physical space that I couldn't quite put my finger on, but I knew it was impactful in some way, even though we weren't really talking about it explicitly. So that led me to kind of, in my master's degree, I started really thinking about, okay, there's something here about architecture, there's something here about space I want to investigate. So I looked kind of more into just doing a little bit of like basically a deep literature review of, okay, how does the physical environment impact learning and how does it impact health? And what can we do about those? How might we sort of reform health promotion? And that's kind of where I thought I was going. And I wanted to kind of get a PhD in architecture to kind of do more of that. And in some ways I did. But I've always kind of just been, you know, open to where various questions take me. So at Berkeley, doing a PhD, I started getting really interested at first in this question of like sedentary behavior. So like we know that sitting is bad, everyone's been talking about it. And we know it's especially bad, not just for the body, but for how learning works. Like, why are we designing these classrooms still? And I had this moment of revelation. I was reading a book called Student Bodies by Heather Prescott, one of my heroes. And one of the first quotes in the book is from, you know, the founding of the earliest institutions of higher education here in the United States. And it was talking about, you know, we're so worried about the sedentary behavior of students. And I thought, oh my God, this is like hundreds of years ago. Why are we still thinking about this? And how come nothing has changed? And of course, it's a very different context then. But they got me really interested in thinking about the fact that history really matters here. Like, I came at this question of sort of health and classroom and campus environments through a very kind of contemporary frame, but realized there was like this deeper historical scholarship. So blah, 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 dissertation happened. And after I graduated, I knew that I wanted to continue teaching. Teaching was kind of like the thing that always tied my experiences together. But being someone who really thinks across disciplines, I wasn't really quite sure where to put myself. No one home felt like home to me. And I was reflecting on sort of who my professional and academic heroes were. And I was remembering the person who's in charge of the Teaching and Learning Center at Berkeley, just being someone who I always admired, and never occurred to me that there was like a career path where I could be her until I moved here to New York and was looking at what I wanted to do, reached out to the Center for Teaching and Learning at Columbia, and luckily kind of there was a fateful opening and I was able to be part of this career path. And it's been a great fit. It's a chance for me to kind of get to scratch the itch of being a scholar, both kind of part of my work as well as in my free time. But it also helps me be sort of a project manager and to kind of, you know, bring together a lot of my different skill sets and interests. So that's a long-winded way of saying I did not have a set plan in kind of pursuing exactly what I'm doing now, but rather kind of this openness to various opportunities and sort of being someone who likes to connect dots that, you know, sometimes fit, sometimes don't fit, but all in service of how to make the world a bit of a healthier place.
It's very cool. It's interesting because it sounds like you've had a very multidisciplinary, you know, background and upbringing and travels through academia. And I guess, you know, that's very similar for Intellect. And we've always been focused on these practice-based disciplines and on the grey areas that exist between disciplines. And I was just wondering, from, you know, bearing in mind sort of my background in publishing, we definitely used to come across a lot of flashpoints. Working in these different areas, did you find that quite difficult, or did you come up against a lot of friction, or did it always seem to be like a natural progression for you?
Yeah, I mean, I think it's not always easy to work across disciplines, and I think I wasn't really as prepared for that. I mean, I studied I studied anthropology as an undergrad while I was sort of a peer health educator. And to me, those two things made sense, right? It's about people and it's about how people kind of make choices and kind of their experiences. So like the kind of challenge was never trying to figure out how to make the pieces fit together, but it was very much about always feeling like a fish out of water, right? So kind of, I never got a second degree in the same area. So then going to kind of this whole world of education, I kind of knew, but it was a program that was for doctors and nurses who were teaching, and here I was kind of this outlier. Like it all made sense. I remember though, like the generosity of, of mentors. I remember going into my first public health course as a doctoral student in architecture at Berkeley, and I was terrified. Like, they do like science and numbers, and it's all very scary and intimidating. And I walked in just like very meekly, like, "Hi, I'm Caitlin, I'm from architecture." And I remembered the instructor was just like, "You're an architect, amazing!" And I like, "That's a technical definition, not really, but yes, okay, great, welcome." And I found public health to be a place that was really open to kind of interdisciplinarity. So I guess what I'm trying to say is there's structures that I think push young scholars in particular to kind of find these gray areas. Like I had to pursue a minor area of study for my PhD, but it doesn't make it, doesn't give you the tools necessarily to speak across disciplines or to kind of be able to to kind of understand like the methodologies quite readily. So I do think it's actually a challenge to work in these gray spaces, but it can be so meaningful, right? And, I think that's where really some of the fun insights are for me. And that's, I think, what I love about doing this work is you kind of find the piece here that seems to fit with the piece here. And then suddenly there's this epiphany or kind of this rich understanding that I think is really productive.
No, I agree completely. I think it's fascinating in terms of the kinds of research you can publish, especially when it comes to maybe anthologies and edited collections and handbooks, things of that nature, where you can get this diverse range of different perspectives on a similar topic. I think it makes for really fascinating sort of research outputs, that's for sure. And what about with academia? Do you feel like the structures have changed to allow for more kind of free-flowing thought between disciplines, in terms of maybe the way that you teach and the way that sort of your experiences of the way conferences have developed and things of that nature? Do you think there's more space for interdisciplinarity now? I know it's a buzzword, but do you think in actuality we are, pursuing it through academic structures, or do you feel it is still kind of like the ugly stepchild that's kept out back?
Yeah, I think that's a really good question. And I think, my particular location, working at a center, makes me, I think, more bullish on, the state of interdisciplinarity. Like almost everything we do is explicitly interdisciplinary. So, what's the value of talking across disciplines about something that we share, which is teaching and pedagogy? There's something that's incredibly valuable there, because at a certain point you can not only just talk about the what that you're teaching, but the how, and you kind of get those methods to be more foreground. What's a common practice here, and how might that, in this very unrelated discipline to mine, help me understand different means of engaging my colleagues? So yeah, I work in a very interdisciplinary space, but that doesn't mean that there isn't like the disciplinary baggage that comes with us, right? I mean, at the end of the day, STEM pedagogies are very different in a lot of ways than maybe, let's say, humanities pedagogies. And that is something I think that is real. I don't think that I'm kind of, enough on the conference circuit and the publishing circuit to really speak to kind of what's the state, but I do think that the grad students I work with are really interested in kind of pushing these boundaries and connecting across disciplines. So yeah, I think I'm optimistic about interdisciplinarity being a thing, but there's a lot that has to change, right? Like higher ed is a huge institution and it touches lots of different things. Like how do applications into programs happen? How does, what does it look like to apply for grants, and kind of in every place you have to check the disciplinary box? Like how does that, how do we maybe kind of push against some of that and make more space for these interdisciplinary conversations and collaborations to happen?
Interesting. And I mean, it'd be interesting to get, well, for you to define what you feel your research interests are kind of in a nutshell. But just something to pick up on before you answer that question. You just mentioned STEM and then the humanities. Does your research or the interdisciplinary nature of your research, does it cross between the more traditional or, the hard sciences and the STEM subjects, and then the more arts and humanities, social sciences and soft sciences? Are you treading a line between both of those worlds?
Yeah, it's a good question. No, I would not put myself in kind of the STEM box, but I did in my dissertation. So my dissertation looked at kind of the pedagogical, architectural, and historical context of bodily education at Vassar College, so the first women's college in the United States. And to do that, of course, right, there's like some historical methods going on there, but there's also some public health methods. Like I was really interested in thinking about, you know, what is kind of like the science of intervention, or kind of how do we define what an illness is, or kind of what a health problem is. So there's kind of different, not only just methods, but kind of different frameworks, right? Different theories at play there. So yeah, I would say I kind of straddle worlds that are maybe a little bit closer, which is, you know, architecture and public health. I think those two do have a lot in common. They certainly are linked historically, and I think are kind of coming back together a bit more now.
Okay. Well, you know, this seems like it might be a good point to jump into a bit of a discussion about the new book, or the recently published book. And I suppose the pandemic has put into perspective the impact of epidemic illness on urban life, and it has exposed the vulnerabilities of societies. So, Caitlin, you and your co-editor, Mohammed Garipur, you've edited this volume, which has been published recently by Intellect, Epidemic Urbanism, Contagious Diseases in Global Cities. So let's talk about that. So first of all, give us you know, the 101. What's it about? And then tell us how that kind of came about and why it's such an important project. And then we can go into a bit more depth about certain chapters and topics that you cover.
Sure, great. So kind of high-level view of the book. This book includes 36 case studies of epidemics or infectious diseases that have visited various cities across the world. It covers 5 continents, from I think starting in the 1400s to today. So the book is divided into 4 different sections. It has an explicit sort of built environment focus, but we're really kind of thinking broadly about that. The first section is about governance. So sort of, you know, yes, there's built environments, and kind of cities are designed, but kind of what are sort of like the power, or kind of the governmental machinations behind all of that. There's then a section on social life. So what's the experience of epidemics? What's the experience of these various interventions? So social life plays a really big role. Then the third section is on infrastructure, so probably something we're kind of accustomed to thinking about, but we like to think sort of big and small infrastructures, as well as sort of social infrastructures. And then the last section is about urban planning and design. So that's kind of the main, I guess, arc of the book. I've talked about the temporal range. Yeah, I think that's the book in a nutshell.
Okay, no, that sounds really cool. So how did it kind of come about, in the sense, what was this a research project that you and Mohammed were doing, or did it come from a conference? How did you kind of realize that you needed to turn this into a book and an edited volume of that?
Yeah, this kind of comes out of 2 conferences. I mean, if we can think kind of in the pre-COVID days, one of the first collaborations Mohammed and I worked on, the 2 of us were kind of connected by a mutual friend in 2018. Then in 2019, we were working on bringing together a group of scholars for a panel at the European Architectural History Network EAHN 2020 conference. And the session was called Public Health in the Early Modern Cities, Salutogenesis Through Architecture. And this is an important moment because, you know, it was a time for the 2 of us to come together, to kind of bring together colleagues who are really looking at, even though cities have long been designed with explicit sort of salutogenic or health enhancing ideas in mind, we don't talk about it a whole lot in architectural history, or it never really seemed like terribly cool to talk about. Hard to imagine now when that's kind of, everyone's talking about this in the era of COVID. So we're excited to bring everyone together. And then of course, 2020 happened and COVID started to break out, and this conference, like everything else, was canceled. But the 2 of us thought, you know, what a time to be studying place and health. I mean, what we were like long been talking about with our colleagues, and what historians have long been saying about the vulnerability of these urban environments to disease. We were seeing this play out in real time, as we thought, God, it's such an urgent topic, and let's bring everyone together. We're also distanced, but there's still Zoom. Let's maybe see if we can, you know, still bring together these colleagues for a conversation. But as you know, as the pandemic wore on, as it became bigger and bigger, and I think more and more urgent, we realized we wanted to do something bigger, and that we were kind of in a place where we could maybe think beyond just this panel and do something else. So we put out a call, I think it was in March 2020, for a symposium that we called Epidemic Urbanism, Reflections on Histories. And we just wanted to collect historical case studies from any time period, any geography, about how have epidemics happened in urban environments, you know, with what impact. And the response was huge, which is in a matter of weeks. We got like 30 submissions. We decided to do like a Zoom webinar for the first time. And I know in today's context, that seems like very everyday, but it was like revolutionary. Like we learned how to do YouTube live streaming to do
Crazy.
this. Yeah, it was phenomenal. I mean, we had hundreds of participants from all across the world. And I think we just realized that, there was, an urgency to really learn from the past, that in a lot of ways what we're experiencing with COVID is, I mean, obviously it is novel and it is unique in kind of its scope. And I think its devastation, especially in places like the US, but it's also not terribly unique in the sense that epidemics have always been with us in urban environments. We cohabitate with germs, so this is always going to happen. So in the words of Dick Jackson, who wrote the epilogue in the Epidemic Urbanism book, he says, learning from history, learning about history is important, but learning from history is urgent. And I think that's really what made us realize that we needed to pay attention to these case studies and I think expand the conversation even more. So we knew we wanted to do a book. We also knew we wanted to get even more voices. So what started off as maybe 20 presentations has become 38 chapters in this case study. We're really proud of the global reach, actually. That's a really important contribution. There's kind of global vulnerability. We're a very connected world. And it's important for us not to just think that, the US experience of COVID or other epidemics is kind of the experience. And so how do we really look at Australia and Africa and Asia and kind of everywhere in between? And the other thing I just wanted to say too about how we knew we wanted to do this book, or kind of how the conference became this book, is one of the great lessons that we kind of heard echo time and time again in these case studies was every time there was some sort of medical or kind of public health advancement, right? We got the vaccine, or we learned about quarantine, and here we are. We kind of were able to overcome this illness. The social vulnerabilities really are unimpacted, right? The kind of inadequate housing or the sort of inequities in society that make some communities more vulnerable, like we haven't really taken that lesson seriously, and you just see this kind of echo in case study after case study. And so we're hoping to I think that's one of the big lessons of the conference as well as the book, is you see this vulnerability play out and kind of go unaddressed. And when are we going to sort of learn that lesson? Well, hopefully soon. Hopefully COVID has been a turning point in which we can really think more critically about that.
Yeah, and I mean, not to diminish the severity or the devastating impact of this, but you and some of your colleagues who work in these fields, there must be a bit of a told you so moment in the sense of, that you were discussing this prior to the pandemic. And of course, I know whether it be Obama or it be former presidents of India and various other countries have been warning about the next great pandemic and how we needed to get our acts together, and obviously complete from the science community. It must have been frustrating then to have been discussing these areas and then not to have seen the practicalities put into place. But then I guess to put maybe a positive spin on that, are you now seeing things that you've discussed or things that you see through these historical case studies actually being changed in real time to maybe affect some change and to try and mean that this is less devastating on the most vulnerable people?
I don't know. I think that's a good point. I mean, I think we're really going to have to see what happens next, right? I mean, vaccines, at least in the US, I know not globally, but we're making a lot of progress toward more people being vaccinated. At first we kind of thought we need to get this book out before the vaccine, right? So that people are still thinking about COVID. And I think we're realizing that this is just one very small part of a broader conversation. I think my take on the question you're asking is that one of the big lessons for me in working on this volume while simultaneously experiencing my first global pandemic is that there's really nothing new here. And in some ways that's comforting, right? Like it would be easy for someone in my social location to kind of think, gosh, poor me, I have to socially isolate, I have to wear a mask. And we certainly heard a lot of that, right? But I think for me, it was kind of a reminder that, the plague, it was like this years-long experience. If we look even closer to home at the 1918 or 19 flu epidemic, there's a case study in Seattle, face masks were like a huge thing, and it was controversial, but also effective. So I guess to answer a different question than what you asked, I think we're kind of seeing that these things have worked, and I'm hoping that we learn that lesson. But another lesson that I'm remembering from the book is there just never really seems to be a great plan. Like, why are we always surprised that an epidemic hits, You know, it's like, in some ways, this is the most predictable crisis. So I think we'll have to see. I think the next few months, maybe the next year, is going to be really important. Like, do schools have plans? Do we have plans for something like childcare? Just today in the New York Times, there was an article in the New York Times parenting section, which I follow. It was basically like, do we have a plan for childcare in the future for the next epidemic? And I think that's going to be where the policies really come in. And, you know, how can we reimagine our cities and actually make some changes in the infrastructures to maybe address equity? So I don't know. I would say the jury is still out. The types of changes that are going to be really important are huge. It's not a kind of a small matter. And I think it's going to take a lot of political will to kind of make the changes that are necessary.
Oh, thank you. A point very well made. I definitely want to get into more of these case studies because I find it fascinating from what I've read of the book as well. But it's also just interesting you mentioned masks there, and then also the bubonic plague, because going back, of course, if you look at history books and things, the most iconic image of the bubonic plague, other than perhaps a rat, is of course the mask that of course everyone was wearing who were dealing with, you know, patients and things. So it's kind of interesting that masks and pandemics have had a long, storied history. I wonder if back in the medieval times, if there was quite such a political, you know, toing and froing when it came to masks, or if people were just glad to have them. I wonder if there was any medieval sociological research that was done at the time on people's feelings about wearing masks or not.
Yeah, I don't know. I mean, you know, certainly it was not uncontroversial. Yeah, it was controversial in Seattle. But yeah, it's a good question. Anyone listening out here, this is a good thesis for someone to investigate.
Sorry, and just to all our listeners, to everyone who's tuned in today, if you've got any questions for Caitlin, please do drop them in the comments section. We can't bring you into the conversation live, but if you drop any questions in the comments, we'll try and get round to them during the duration of this conversation today. But Caitlin, let's talk a bit more about these case studies then, because I know, for example, there's talk about like the first time there was a quarantine in Europe and things of that nature. Tell us a bit more, maybe highlight, I know you can't highlight everyone, but maybe highlight a few of the interesting case studies from those 36 chapters. Just let us know a bit more about it.
Sure. One of the chapters that I think has really stuck with me is a case study from Sao Paulo, Brazil. I think it's in the 1970s. There was a meningitis outbreak. And the chapter is incredible because it talks about so many of the themes. It's sort of like a best of all of the things to not do. You know, first of all, there's this outbreak of meningitis, which is a very scary infectious illness. And, you know, first there was kind of this hesitance to really acknowledge it publicly because, you know, we didn't want to interrupt this kind of notion of progress or kind of, you know, how might that be seen? And then the author Daniela Sandler talks about how, you know, the illness sort of worked its way in concentric circles from kind of the outer parts of the city. So like kind of the poorer parts of town to kind of the more like the wealthier areas in the center of town. It's a tale of kind of connection, right? So about like transportation, how are especially domestic workers coming into the center of the city? How is that commingling helping to spread the illness? It's a tale, of course, also of lack of access to care. So one of the points that this case study makes is one of the reasons why the kind of outer neighborhoods were so devastated is that kind of the way healthcare worked is that it was very centralized. And you imagine in any crisis, the transportation gets infinitely more difficult. So I think the case study also makes a really beautiful point for the need for sort of more decentralized care. And that's a beautiful kind of infrastructural point too, and something that I think resonates not just in times of epidemics or any other sorts of public health crises, but you know, there's very real ongoing public health needs in communities that are not served by kind of conventional or sort of centralized medical systems. So how do we maybe take that point more broadly?
That's really interesting you say that. So what kind of calls for action would you say have come out of the book? Because that seems like there's one you're alluding to right there. Are there any other kind of key things that you know you use these historical case studies, and then especially now in light of the pandemic that you're basically alluding to what we need to do or how we can make big changes that would affect this in the future?
Yeah, I mean, I think so, certainly, right? Like healthcare is one of them, but I think, you know, it's basic to say, but adequate housing, you know, this is a really big issue. I mean, we're thinking about, you know, if you live in a place that is not sanitary, or maybe that there's kind of greater infestation of rats, right? We saw this play out time and time again. but also thinking about you know, the need for a plan. And again, this sounds really obvious, but I'm thinking here of a case study from York, England, cholera epidemic. And even though York was kind of renowned to be this like center of medical practice, there was a lot of confusion about what to do. And there's always going to be confusion with the onset of any sort of new outbreak. But, you know, there's got to be sort of like, okay, if there's an infectious illness, like here's what we're going to be doing. So I think that there's, you know, there are some things to do in terms of like intervening in the built environment. But I think in our opening comments, Mohammed and I also point to some sort of broader takeaways that we're hoping come from the book too. So it's not just, you know, that there's kind of this recipe for like how to design a city or kind of how to intervene, but we're hoping that, you know, this book we explicitly designed to be speaking to practitioners as well as academics, but also to the general public. And we're hoping that anyone reading this book first kind of takes away this like broader view, like how do we see the news that's happening? How do we kind of understand our current pandemic with this broader view? And then for any sort of academics reading, like how do we also adopt a different lens? Like there's so much that's important about any, like, you know, if you're teaching architectural history, think about public health stakes. Or if you're teaching public health, like what's the value of really thinking about architecture and kind of cities and the built environment? And we're hoping too that not just thinking about, you know, people who are in charge of like building an aqueduct or something, or, you know, designing housing or kind of thinking about housing policies, but there's likely something that each of us can do in our social and professional locations that in some way can kind of help, right? Whether that's educating, whether that's bringing people together, whether that's amplifying important things to know, whether that's actually making an intervention. So I think our calls to action, I think, also go beyond just the built environment here too, if that makes sense.
Yeah, no, great. Thanks, Caitlin. That's a great point again, and it leads me on to one of my next. Really, there's a lot of books out there right now that discuss epidemics and pandemics from through many different lenses. There's a lot of noise, and there's a lot of great books that have been published in light of the COVID and the pandemic. Some are cashing in, and some are really important, you know, works of research. So, going beyond what you've already said, what kind of, you know, what makes this book different, and what makes it sort of so important? What do you do that's so important and different?
Yeah, that's a good question. I mean, I think first the emphasis on the built environment is actually a really productive one. It's kind of one of the unique contributions of the book. So, you know, it enables us to kind of really focus in on parts of the urban fabric that are kind of the sites and instruments of intervention. So rather than that being kind of backdrop, that really is thinking about, okay, how does this work? By us shining the light also on kind of governance, we're thinking about what are the systems of power that are either mobilized in service of these grand projects, or kind of what are the stories we tell ourselves, like how is power leveraged in these times of crisis, which is actually a really important thing for us to be thinking about. The built environment also is kind of a vector, or kind of enables these vectors, right? So we can really think through like how do these maybe like the germs or the microbes or like the infected fleas, how do they gain advantage in environments that are not maintained or that are not sanitary or that are poorly designed? So we can really think about kind of the built environment playing sort of an active role. But I think the built environment also helps illustrate in a really beautiful way a point that I know Frank Snowden kind of, you know, he wrote Epidemics in Society, like a major book in this field. He talks about how epidemics are not random, right? We like to think, you know, anyone could get infected, and in theory that's true. But I think the built environment helps us see that, in fact, these patterns of illness across time and geographies are always spatialized. The patterns map onto certain aspects of the built fabric that are really important for us to pay attention to, learn from, and design differently. What else is important about this book? It's its scale, it's its reach. Again, going back to the 36 chapters across all continents. That's a really important part of the book. I think we tried really hard to get case studies. They're not from everywhere, but it's a very broad set of stories that we tell across time and geography. And I think, not to understate the point, but it's a beautiful book. We put a lot of work into ensuring that it would speak to a range of audiences. We didn't want it to be some ephemeral kind of dry read. We wanted it to be something that really captivated folks for whom this may not be their primary area of interest, but who would be brought in by the short format of the chapters, by the beautiful illustrations. I mean, you know, just the cover alone I think is gorgeous. Like, shout out to my friend Jackie Skidmore, epidemiologist, also photographer, who took this photo of Domino Park. But it was really important for us to make a book that would really speak to a wide variety of audiences, including the general public, and be something that would be lasting. Like, we wanted folks to return to this book. And I think that the illustrations in there are just absolutely incredible.
Wonderful, Caitlin. Well, I've got a couple of questions from the audience, which I'm going to get to in a minute. So don't worry, guys. We will get to them. But first of all, I just want to congratulate you, Caitlin, Mohammed, and all of the contributors to the book. As you say, it's beautiful. It is truly fascinating, and it you know, you don't have to be an expert to enjoy it. You know, it's fascinating history across all these different disciplines, and really multidisciplinary. And I found it a fascinating read. It's also getting really good reviews, and you know, hopefully we've got a few interviews and things lined up with you in the media. So it's wonderful to see it getting the traction it deserves, especially at a time when there's a lot of books that are discussing disease and you know, and epidemics and things of that nature. So genuinely congratulations. If anyone wants to find out more about the book, you can go to www.intellectbooks.com and just put in Epidemic Urbanism in the search engine, and then you can find out loads more. You can order it there and all of that good stuff. And also in the chat function, you will see this too, but you can go to www.epidemicurbanism.com and find out much more about the book, but also about, I believe there's been a few other initiatives, which, before I get onto the questions from the audience, I just wanted to ask you, what's the broader reaching impact then beyond the book? What's going on? What's the next steps? And what are the Epidemic Urbanism initiatives all about?
Yeah, so simultaneous to kind of us having this initial symposium where Epidemic Urbanism kind of started and the book came from that, we also just wanted to kind of capitalize on the fact that there's this like network of scholars that are kind of globally converging around this topic. So Epidemic Urbanism Initiative, Mohammed and I founded in May 2020, and it's essentially, it's a collaborative. It's a kind of global collaborative that really seeks to sort of understand how epidemics past and present have impacted urban environments and vice versa. We're really trying to sort of bring together thinkers and practitioners and members of the public to really work toward meaningful change in urban settings. So right now, what this has looked like is we've convened, I think, 3 or 4 international symposia, you know, very similar to kind of our initial effort. We also did a design competition in October, which was really wonderful. So kind of thinking about how do we kind of better design for vulnerable communities. So I saw that there was a question in the chat about what's next for architecture. I think that's one of the ways we're trying to answer that question through the initiative. We also have teaching workshops coming up. We have a conversation coming up through Society of Architectural Historians about why health matters to architectural history. So we're really trying to kind of keep these conversations going, but to also think beyond just COVID, right? I mean, this was kind of one epidemic. This was kind of one natural health disaster that's come upon us, but what can we learn from it? What's next? How do we leverage these insights towards thinking about more just and equitable and resilient and health promoting urban environments? So that's the initiative. I also just want to say that on our site, as well as on our YouTube channel, Epidemic Urbanism, we have recordings of all the materials. So one of our commitments through the initiative is to ensure that all the materials that are produced through the initiative are publicly accessible. They're completely free. We're hoping that folks use them in their classrooms. And in fact, we've received really lovely notes from scholars and teachers who are using these materials as part of their teaching, which I think has been lovely, right? How do we make these conversations accessible more broadly? So that's the initiative. Mohammed, feel free to toss in the chat anything I forgot about the initiative.
And again, everyone, just do check out www.epidemicurbanism.com and you'll find out more about the initiative and, of course, the book right there. That kind of nicely brings me onto one of the audience questions, which, again, this isn't to diminish the severity, but again, it's kind of good to put it into perspective as well. They say, what's your favorite plague? And then in parenthesis, to study. So historically speaking, what infectious diseases, what pandemics have you found most interesting to study and why?
That's a great question and one I didn't think to play favorites on. Yeah, like, what's your favorite microbe? I think it's a good question, and I think my take on that is going to be, you know, the plague is very much studied. The plague in Europe is very much studied. What I found interesting, though, to kind of tie this back to the book, there's a really lovely chapter about the role that women played as caregivers during the plague in domestic environments. And so I think my favorite kind of plague to study is one that kind of helps us look past maybe the obvious questions, but to really have this deeper understanding of maybe agency, maybe community building, maybe, you know, things like gender and power. Because again, these epidemics, they exploit, they amplify kind of all these social relationships. So yeah, I don't think I have a particular plague that's my favorite, but approach that's my favorite.
That's really cool. That's a really cool answer to a slightly difficult question. Interestingly, so where could where might people find out a bit more about sort of the role of, I mean, gender and women in terms of caregivers and agency within various places? Is there any particular books, or you did mention a chapter there? Is there anything that you would advise people to seek out if they wanted to find out a bit more about those kind of topics?
Yeah, I mean, I think maybe starting with the book, and that's probably like the extent of my knowledge on that particular subject. But yeah, so the chapter is by Rachel Clamp. In the book, it's in our urban life section. It's a good starting point, right? Really kind of thinking about how do we take kind of a different approach to what we think we know about something as studied as the plague.
Awesome. Oh, thank you. All right. Well, then that leads me on to a question from Dr. Sarah Gilligan. So, Caitlin, what do you feel is the key lesson that architects need to learn from the current pandemic? What are the new directions for the built environment? It's a good question.
That's good. I'm actually going to deviate from the book here, with apologies to James. To that question, this is really
more than just a sales conversation, that's for sure.
No, I'm just kidding. Yeah, this was really kind of the primary question that motivated us to want to pursue this design competition. You know, we kind of wanted to say, like, so what? So the way that we answered the so what is to really think about what are kind of spaces of vulnerability that we've really learned about that become incredibly clear through the pandemic. So really thinking about we really need to think through spaces for senior care. That was a kind of institution that was really hard hit during this pandemic. So how do we kind of think through not just making that a safer space for a very vulnerable population, but how do you build resilience, connection? Schools too, I think we really need to think more about schools, K-12 environments. It's been devastating, I think, for kids to be thrown into these remote settings, kind of away from their colleagues. So that's another group that we're really thinking about. And there's some really lovely examples of what this could look like. Also public parks. So again, public parks get a lot of attention, but I think there's been so much more renewed appreciation for the need in especially dense urban environments for a place to gather that you can also still socially distance. Many of us don't have the luxury of being apart from those that we live with, even you know, in places like New York City. So parks are going to be really important, or kind of open spaces. And I'm forgetting the last, community clinics. Just, we talked about, you know, there is a case study in here that kind of makes that case, but I think we realized that one thing COVID taught us is that we can be really flexible in kind of where care happens and how care can be accessed, and how do we kind of learn that lesson more broadly. So it's not just in these times of crisis, but for communities that don't have reliable or adequate access to care, how can some of this flexibility that we've innovated so beautifully during COVID help us approach new paradigms and spaces of care? So those are some examples. Again, see YouTube and see our website for more on those topics. Great question.
Thank you, Caitlin, and thank you, Sarah. That a great answer to a great question. And also, you know, it's been a bit doom and gloom the last couple of years, and we often talk about COVID indirectly through various different subjects on In Conversation here on a weekly basis. But we're obviously, this is kind of talking about COVID more directly for the first time ever, and it's nice to hear some positives that have kind of come out of the realities of it. So yeah, great to hear your answers to that question. But that's enough on disease. Let's mix it up a bit. We're kind of into the last, you know, sort of 10-15 minutes of the In Conversation today. Well, first of all, Meridian Muse says, congratulations on that wonderful book. Think about expanding your message by having it accessible in Spanish too. Well, as the publisher, I can say that we're already in those discussions. So watch this space. There may well be a Spanish language book coming out at some point in the near future. But for now, you'll have to read the English version. But that's something that we're definitely looking to do, and we're always trying to sort of widen access, you know, through, you know, making things available in different languages and open access and all of those other good things. So do keep a look at our website and for more information about that. But yeah, I wanted to ask you a few more kind of general questions, just sort of like some slightly fun questions, I suppose. So first of all, who would you say are your sort of biggest inspirations, both academically, but then in life?
It's a good question. Yeah, so I've been reading a lot. I've been revisiting the work of Dr. Sandro Galea recently, who's become kind of one of my professional intellectual heroes. He's the dean of the School of Public Health at Boston. And in the last couple of months, I've been kind of revisiting some of his work. He did write the preface to our volume, but he wrote this really beautiful essay in the Lancet, I think in 2020, and it basically is like compassion in the time of COVID-19. I mean, right there, I am like totally on board with him. But he really talks about you know, not just kind of the need to really invest in social determinants of health, as we've talked about, but he talks about really the need to not just like recognize and take for granted these deep inequities, but to be compelled to actually intervene in some way. And I think why, like one of the reasons why he's my one of my heroes, or kind of one of my inspirations, is that he writes so beautifully and so compellingly to a wide variety of audiences. I mean, this is in the Lancet, and here I am, you know, reading it and feeling really compelled. So I think he's someone I aspire to kind of, you know, be able to write and to kind of be sort of a gatherer in that regard, a gatherer of different perspectives. I've also been reading a lot. So one of my advisors at Berkeley was the late Paul Groth, who just passed away last month. And I've been reading kind of a celebration of his work in the online space, the platform, and being reminded that he really is someone who shaped me intellectually as well as a pedagogue. There was nothing finer than being one of Paul Groth's TAs, teaching assistants, as well as someone in one of his seminars. So just reading through kind of essays that his students past and present have written. They're all kind of dispersed across the globe in these like really impressive academic roles, but you know, to kind of be able to trace that lineage back to this person and to kind of reflect on my own development. So he's very much been on my mind recently as I've been working my way through these essays.
And talking about reflecting on your own development, do you have any top tips perhaps for any emerging scholars or people making their first foray into publishing or into their, you know, research? Any top tips, any advice you might give?
That's a really good question. I mean, I think first is be open. You know, I think that career trajectories are looking very, very different. And I think that's an okay thing. That's a good thing. It could be really scary to not necessarily follow traditional pathways, but I've found it really exciting to kind of explore new territories. But also I have to say, and I hope Mohammed's still on the call, but I think the power of finding a community, I think, is also really powerful. I mean, my collaboration with Mohammed has been like huge and wonderful, and he's just an excellent colleague and someone who's been I think really formative in my development, a good supporter. And even just this whole project, for some reason we just got so lucky to work with just the greatest people. So find your folks, right? Find the people who can support you, who can help you grow, who can kind of encourage you to do the scary things, because in those scary things, I think, can be real opportunity to try new things, to develop new skills. So top tips from Caitlin DeClercq.
Hey, no, I think that's a great top tip. And I mean, in addition to that, I think just to go further, it's all about putting yourself out there. So, you know, don't be afraid to submit that article to a journal. And then, you know, you'll probably get a lot of knockbacks. But every time you get a knockback, you're getting peer-reviewed research. You're getting peer-reviewed, you know, sort of critique on your own work, and that will help you develop. And especially if you're undergoing the PhD process, writing your dissertation, you know, it could really expedite your own writing and really, you know, improve it at an early stage. And the same with conferences. Attend, you know, interrupt, put your hand up, ask as many questions as possible, and again, do reach out to publishers and ask them for their advice. And again, show us your work, and you can gain a lot of valuable insight and a lot of constructive criticism. Even if, you know, you're not quite ready to publish yet, it's worth, you know, investing, you know, some time in developing that, I'd say. So yeah, a good top tip, Caitlin, definitely, for sure. Very quickly, I will also say we've only got a short amount of time left, but if anyone has any questions, this is your opportunity. I've got a few more fun ones, but also another comment really from Dr. Gilligan saying fascinating stuff, and she'd be interested in reflecting on fashion spaces and the pandemic and the shifts in retail, which is an interesting one, especially from a New York perspective, looking at how, you know, Fifth Avenue closed down, and, you know, and how certain retail spaces have changed, moved online, you know, and we've seen a resurgence in maybe more bespoke, independent and luxury brands, and, you know, from a craft perspective as well. And, you know, and the downfall of some of the more high street spaces or their monopoly. So that's definitely food for thought, I think. I don't know if you have any quick thoughts on that, Caitlin. Otherwise we can, you know, we can move on, but.
I don't. You said it beautifully, so we'll let you have the last word on that.
Well, I mean, I'm sure put you and Sarah in touch after this, and I'm sure you guys will have a lot of interesting conversations to talk about. But okay, well, let's talk a little bit about New York, because we're both based there, and I'm reliably informed that you're quite a foodie. So talking about the urban environment, I think food and restaurants and street food and all the rest of it are definitely a big part of the urban environment. So top tips again, but what's your favorite kind of foodie spots in New York City? Anywhere that you would recommend for people? Or just tell us a little bit about, you know, how you enjoy the city from a foodie perspective.
Yeah, well, I mean, my first time living in New York was like as a grad student. I had no money. And one thing I thought was so magical about this city that I'd heard so much about how expensive it was, and it is, but you can also get dollar falafel still. So Mamoon's Falafel, if you're anywhere in the neighborhood of Washington Square Park, best $3 you'll ever spend. Maybe it's $3.75 now because of inflation. Who knows?
I know exactly what you mean. That is a good joint.
Yeah, exactly. So yeah, that's the nice thing. So like, find the cheap food. It exists. I mean, I have to say I've got a soft spot for a hot dog on the steps of the Met. Is it the greatest foodie thing? No, but it's fabulous. So yeah, I think that was one thing that was really surprising me about the city, is that there's so much to see that's free. There's like live music in the park, and it's incredible. In terms of like more conventional foodie locations, I have not been able to go recently because of the pandemic, but Barbudo in the West Village is like a space that I went. It was the first time I saw a celebrity eating at the restaurant, which was very exciting for a small town girl. And it's one of those restaurants that like they treat you really well. The service is great. Every time I go, the food's incredible. I'm a little bit picky about food, so I get really disappointed when it's like some place that's been hyped up and you go and you're like, nah, but the Brussels sprouts are just so. Everything's always been so everyone should go, but not go. Make sure you save a spot for me once the pandemic's done and I can go back and eat indoors.
I've got to ask you, who was the celeb?
It was Josh Charles, who I did not know at the time, and I'm since a fan of, but I recognize him like, this guy is famous. But I also saw Sally Field there once upon a time. Lots of folks. It ended up being like the place where I would go. I also saw Jonathan Waxman, the chef there, which was very exciting for like the inner Top Chef fan. So Barbudo's a good place to people watch.
No, that's true. Well, I'm going to tell you one of mine then. So I moved to New York at the end of 2019. So just prior to the pandemic, I then went on it was a work trip, but it was also a culinary odyssey because it was Mexico. So I was working in Mexico City, several other places, and I was there on a business trip for 3 weeks, and I definitely put on some weight, and my liver definitely regretted it too. But got back to New York, had all these plans, and then a week later, effectively, lockdown, pandemic. But, you know, things change. So I then spent the next couple of years effectively just walking kind of aimlessly all around New York, you know, in all my free time, especially during the height of the lockdowns, and then just stopping and just whenever there was an interesting food place, just going and seeing what was there and just going really block for block. And one of the amazing things about New York in general, especially in, say, Brooklyn, is the diversity of like people, cultures, and then of course the cuisines within such a short space of time. So you can be in Hasidic Jewish food 1 minute, then you're in a Dominican neighborhood, then you're in a Mexican neighborhood, then you're, you know, an African American neighborhood, a Caribbean part of, you know, that neighborhood too. All these different things. So you can get really fat on one day's journey, but if you need to walk at least 20 miles to justify all the different foodstuffs you can eat. But that's been one of my silver linings of the whole pandemic, just wandering aimlessly and then finding, you know, wonderful food. And again, New York is so expensive, but at the same time, so many different people, you know, from so many different economic backgrounds live there that you can always find something for $1 or less, you know, and it's just about hunting out those local delicacies. And for me, it's definitely some of the, like more like the Dominican spots and some of the Puerto Rican places, and then some of the Mexican taco places where you can literally get some of the best food in the city for $1 or $1.50 or something like that. And again, it's maybe cuisine that I haven't so accustomed to and used to from living in the UK, you know, where, you know, we've got like a different wealth and depth of wonderful global food these days. But yeah, no, New York is a special place culinary wise. And, you know, you obviously have got an architectural background. Do you love the architecture of New York, or are there other cities that you sort of, you know, you're more drawn to architecturally speaking? And it doesn't have to be globally speaking as well.
Oh no, I'm a New York fangirl. I mean, New York is #1 in my book. You know, obviously, you know, there's other beautiful cities, but there's nothing that gives me more pleasure than running around the reservoir in Central Park and just looking back at kind of the high rises in Midtown. That's not my favorite architecture, but New York is just a really great place to be a fan of architecture because it's beautiful, it's diverse, even just like the brownstones and the townhouses. I think there's nothing more magical than I think some of the more historic architecture here in the city. Yeah. So
Yeah,
New York is #1 in my book.
I mean,
Others are quite good.
I'm a big fan of Chicago, if we're talking about American architecture too. And then, of course, being raised in Europe, we've obviously got a great history and depth of architecture. And of course, we've been discussing Mohammed Garipur, your co-editor, and I would just like to give him his flowers and say many thanks to Mohammed for all of the work that you've done on behalf of Intellect and on behalf of the architectural community. But Mohammed is the principal and founding editor of our Journal of Islamic Architecture, and I would like to spend a bit more time in the Islamic world because what I have seen there, architecturally speaking, both in terms of the traditional styles, but then also, of course, kind of the modern styles in sort of like a Dubai or something. I'd like to spend more time sort of familiarizing myself with that, the ancient and modern cities of the Islamic world. So yeah, everyone check out the Journal of Islamic, the International Journal of Islamic Architecture. Again, you can find that at intellectbooks.com, and you can download a free issue as well. So do check out that, and do check out the work of Dr. Mohammed Garipur, who again is co-editor with Caitlin on Epidemic Urbanisms. What else are we going to talk about here today? So, well, just in general, do you prefer the city life or more of the country life? Because I mean, you grew up in California. Were you raised in a city out there, or were you more kind of in a rural area?
Yeah, I was. So I was born and raised in the Central Valley of California, which is kind of very agricultural. I'd say my kind of like my spatial experience was more suburban. Like there was the mall and like the cul-de-sac and all of that. My husband hates when I say this phrase, but I'm a city rat. Like I have always loved cities. I have just been so fascinated by them. So I cannot. I mean, I hope to like grow old in New York City. And, yeah, spend my days in the city. So I'm very much on the city side of that equation.
Well, was it your love of the city that informed your love of architecture, or did they kind of grow hand in hand, or was that kind of like a separate thing?
That's a really good question. I mean, I think in some way they must kind of co-inform each other. And yeah, I mean, I can remember like going on runs in, San Francisco, or like, Berkeley, and like always instead of looking at like the view of the bay, I'd be looking at the houses. So I think in some way I was like, I was tuned into the built fabric without really having an understanding of what that was. But of course, then getting to study architecture, you can appreciate all that even more. So I would say it probably is more of co-informing, or maybe studying architecture gave me a way to really put to words or to kind of have a more informed lens about what I was seeing and appreciating so much about these awe-inspiring big cities, and kind of the experience in them.
And with that note, one more question on architecture then. Are there any particular styles, or schools of architecture that particularly inspire you, or any particular periods in architectural history that you're drawn to?
Can I give the rogue answer here, which is I think I'm less drawn to a specific style, although the older the better. And I think more what I'm interested in architecture is its use. I mean, I was in the social factors in architecture program, so in some ways, I love the aesthetics, but I think what makes me really fall in love with a building, or really fall in love with a style or an approach, or like a way of practicing is what's the intentionality and what's the experience of it. It's always a hard question for me to answer, like what's my favorite building. I mean, a lot of ways my favorite buildings aren't even buildings. They're like parks, or kind of like playgrounds, or like kind of makeshift areas in the city that have really been designed with a specific use and have been done so very well. But I will say, again, to answer a question you didn't ask, college campuses are my soft spot. It's not one specific style, but I love college campuses. Like that is the most fascinating array, and it's all styles, but it's also like very much an approach to sort of how people are going to interact and engage, and is the environment a pedagogical tool or is it not, and what's the relationship to the city. So that is.
Well, you and I, we're going to have to nerd out on this at another time, because that's actually one of my favorite things as well. Because with my role at Intellect has often had a sales function, but also a commissioning function. So I spend a lot of time pre-pandemic anyway on university campuses all over the world, Australasia, India, North America. And I love the way that the kind of the form and the function changes, even though they're all performing effectively the same, their educational platforms or educational spaces. And I love how they approach that differently. And then again, just like, like the campus unis, like, versus a city university like Columbia, then the old red bricks in the UK versus, almost as old universities in Delhi and places like that. And then you come to, say, more modern universities in the US. One of my favorites is the University of Cincinnati. When we talk about architectural, a lot of people hate it because of the fact it's like a menagerie of all these who architects from like the modern era, from Zaha Hadid through to, whoever else it might be. So you've got like a brutalist structure stood there next to a sort of hyper modern, or a postmodern kind of architectural style. I always find that like a weird, it's almost like if someone collected, architects or architectural styles, it's like a top trumps for universities when it comes to form. But yeah, anyway, I digress. But yeah, I love the way that universities kind of adapt and adopt using structure. But for you, though, so it sounds like it's more function over form.
Yeah, I mean, to a certain extent, right? I mean, who doesn't love like the El Dorado apartment building? I mean, I can appreciate, but I also very much taking a critical eye at all times. Who does this serve? Like, what's the social part of, architecture is a social art. So that's usually not too far behind, but of course it's easy to be mesmerized by the big ones.
Well, look, last two questions, and I'm going to jump around. I want to ask you one more foodie question. I hope you like pizza, because I ask everyone who lives in New York this, because everyone's got a different answer. What's your favorite pizza joint in New York then?
Oh, this is such a hard one.
Oh yeah, I'm not leaving you a one.
Yeah, okay, so it's also, we're a split household, but I will say my local favorite in this neighborhood is Motorino, which I don't think is particularly in New York, but it's delicious. So that's my favorite. Yeah, I'll stick with that.
I mean, I'm sorry we've gone a little New York on this to everyone out there who is living or joining us from all over the world. But if you make it to the great city of New York, there's some top tips for you. And one of the things you have to do, whether you're a vegan or you're a meat eater, is definitely find out a few decent New York slice shops. That's for sure. I will leave you with this one final question. What's next for you, Caitlin? What's on the horizon? What are you working on now? Or is there anything you want to highlight, or any organizations you want to highlight? Here's a free bit of space for you just to talk a bit about what's going on.
Yeah, I mean, I think really it's bringing the Epidemic Urbanism initiative to kind of its next phase. We're really excited about upcoming events we have. We're going to be talking about kind of what's next for architectural education, both in the US and globally. That's a really exciting conversation to have in many different ways. We also are really trying to kind of empower members of our community to kind of take initiatives and go. So that's going to be really exciting. That's going to be happening through our upcoming teaching workshops. So for me, it's kind of all things Epidemic Urbanism initiative, because I think that is such a robust community. We, I think, have 72 liaisons in different countries across the world. So it's about kind of finding different ways to engage with them, connect, and, hopefully make some meaningful change in the various cities that we occupy across the world.
Wonderful. Well, Caitlin, thank you so much for your time today. I really appreciate you joining us, and you've really kicked off this next series of In Conversations for 2022 with a real bang. I'm really glad to have had you on as my first guest for the year. To everyone out there who's joined us, thank you so much again for joining us. Thanks for the wonderful questions. For people who joined a little bit later, this whole conversation, along with all of the preceding pre-conversations from the last couple of years, are available on our IGTV. And also, I'm happy to say that over the next week, we will be launching our new YouTube channel, which will, of course, host all of these In Conversations, and then lots of other incredible sort of videos and interviews with people from the Intellect community and further afield, some of which will, of course, include some of the Epidemic Urbanism content that Caitlin discussed earlier as well. So do keep an eye out for that. Just another reminder, if you want to find out more about epidemic urbanism and some of the issues discussed here in conversation today, go to www.intellectbooks.com and just Google Caitlin or Google Epidemic Urbanism. Fantastic book. So many congratulations again to you, Mohammed, and all of the contributors who've made that book possible. It's an all singing, all dancing wonder book, and we're so glad that you published it with us. So many congratulations and many thanks for all of that too. And then again, if you want to find out a bit more about the initiative, more broadly speaking, www.epidemicurbanisms.com. Okay. So yeah, Caitlin, thank you so much. Everyone, thank you for joining us. And we'll be back again next week with a new in conversation. We'll be posting who our guests will be in the next few days. Caitlin, any final thoughts from you?
No, just to say thank you so much. This was lovely.
Yes, it's been a real gem and a real pleasure. So thank you for your time, and we will see you again in the future. Take care, everybody. Thanks very much.